All right. Good evening, everybody. Welcome to tonight's topic of bereavement doulas. And just making sure. Okay, so tonight's topic of bereavement doulas for Pregnancy and Infant Loss Awareness Month. This week specifically is Pregnancy and Infant Loss Awareness Week, even though they're the whole month. So tonight's topic is bereavement doulas, and what do they do and why are they important? And I am so honored to have this evening three incredible organizations within the Maryland, Northern Virginia communities who are providing birth and bereavement and postpartum support in all the ways that they do. And so instead of me talking and introducing them, because then it'll just be the Jessie show, I'm going to turn it over to each of these incredible panelists and let them do a little brief introduction of who they are and where they're located. And then we're going to get into the conversation. So if you're watching this live, feel free to post any questions or comments as you are watching this. I am keeping my eye on what you're saying, and we're just going to go with the flow. All right, so without further ado, I am going to introduce the first guest speaker, Jasmine Mason of the J. Mason Foundation, based in Northern Virginia.
Hi, everyone. So I am Jasmine Mason of J. Mason Foundation. So a little bit about me is I do live in the Northern Virginia area, and I started J. Mason Foundation in 2018 after my miscarriage. I then transitioned into the doula role to support moms in birth and loss. So I have a special place in my heart for those who have lost babies, simply because I had 2 miscarriages myself, so I know what it's like to experience loss and how you feel afterwards, and then what you experience in the birthing room as far as that healthcare system not really playing their part.
Well, I'm so glad that you're here tonight because I'm sure we've got much to talk about. So, all right. So next, I'm going to bring up Carling from the Baltimore Doula Project.
Good evening. My name is Carling Southern, and I'm here tonight representing the Baltimore Doula Project, which is a organization based in Baltimore that provides full spectrum doula support, which means that we work with people throughout all stages of pregnancy. So we support people through experiences of abortion, miscarriage, loss, birth, and postpartum. So tonight I want to focus on our work around abortion and pregnancy loss. We have a network of doulas based in the Baltimore area that provide support often for free or on a sliding scale basis. And we offer trainings to anyone in the area that wants to volunteer with us as an abortion doula.
Awesome. Thank you so much, Carly. I'm glad to have you guys here represented tonight. And then last but not least, I've got Rachel from In Family Ways. They provide birthing and postpartum and bereavement support.
Yep, so excited to be here. Thank you for joining in this evening. I'm Rachel. I represent Family Ways, and kind of like Carling, we do a full spectrum support. So we offer everything from early loss support, later term loss support, planned loss, unexpected loss, abortion, miscarriage, stillbirth. We've supported families through every part of that process, as well as birth, postpartum, and postpartum bereavement as well. So often, we see that there's an increasing awareness in the hospital. Maybe not what it should be, but at least an increasing awareness of providing in-hospital support, but often families are going home with very limited support in the postpartum period. So we try to provide that ongoing bereavement support as well. So very happy to be a part of this conversation tonight.
Awesome. Well, thank you so much. And so I kind of want to hop back to Carling because we were chatting earlier, but this is also a really, really critical topic right now. Not to sound political, but life itself is political. And so we know that we need to kind of boost the conversation and the topic matter of abortion support. And so I do want to kind of talk a little bit about what does that look like? And I know like all of you provide that type of support, but Carling specifically with the Baltimore Doula Project, like what does a bereavement, okay, so let me backtrack that then. So what the heck does a bereavement doula do? And then we can talk about a little bit more about the specifics. Sorry, I told you this is like such an interesting topic and so passionate on so many ways. And I apologize ahead of time. I will probably mute myself so you don't hear the barking fiasco in the background. Like many of you, you have children in the background. I have fur-legged things that are in the background or outside. But let's kind of backtrack a little bit and talk a little bit more about what does a bereavement doula actually do? Because that's kind of really the basis of what all of you do. But what does it look like? How does it differ from, say, a birth or a postpartum doula?
So the role of a doula can take on many facets, no matter what the outcome of the pregnancy is. And it really depends on what the client needs. So bereavement work is about being present with people. It's about holding space and offering support and resources and showing up for people in ways that maybe others aren't as familiar with or don't feel as comfortable with. The role of a doula, they're trained in providing this particular kind of support, which allows them to be aware of things that maybe a family member wouldn't be aware of in terms of options. And, they have specialized training to be able to be most helpful in situations of loss or abortion or miscarriage.
Anybody else want to add anything to the basis, the foundation of what a bereavement doula does?
I'm happy to add a little bit too. That one of the big pieces of the work that we're doing is advocacy and helping families with their advocacy. Certainly, for us as doulas, often the advocacy role is alongside the family, but just as often it's in the community or working, from different angles, talking to the chaplains at the hospital, talking to the bereavement coordinators at the hospital to try to help maybe change the landscape a little bit or change what they're offering and providing. But one sort of like fairly common story for families is that they get some news of some sort and they make a decision and then they feel like they have no options, that they're just going to be like swept along in the hospital system or the clinic system or, whatever their landscape is, and that they're going to be told how to proceed through that. But we as doulas often help to sort of reframe the narrative that you're still in charge of your story and you can choose, and it doesn't have to be what a particular structure is dictating that it has to be. You have options, you have choices that you can make along the way. There's a lot that we can do to help make this a journey that you're or hold on to in some way, hopefully in a positive frame. And what does that look like? And how do we craft that? And how do we make this a meaningful experience, whatever this journey looks like and however it takes shape? And so, we work alongside the families to help craft that narrative and like help them figure out what's meaningful for them. Very much similar in a lot of ways to work that we're doing as birth doulas, for a planned term birth, but maybe with a slightly different context, different framework, and then figuring out what are the tools that we're going to use to help you as the family communicate with the staff at, wherever it is that you're receiving care.
Jasmine, anything else as the work?
I definitely agree with everything that has been said already. However, I know a lot of times when moms experience loss, they're often told how to grieve. They're told how to feel. And as a bereavement doula, we also have to validate the person's feelings, and let them know that it's okay to be sad. It's okay not to be okay. And it's also okay to seek out help, help as in therapy, or help as in, hey, I need a friend right now. Can you please listen? A lot of times I have people to reach out to me and they just want me to listen, not to say anything, because a lot of times when you talk to your friends, they give you like a response or advice that was unsolicited. So I think that that is very important as a bereavement doula, is just to hold space for that person and be a listening ear when needed.
Absolutely, absolutely. And I think that's one of the critical roles of having a doula we need life doulas, right? Everybody needs a doula in their world, like just to listen, don't have to respond, don't have to do anything, just sit there, listen and watch me. Like that is it, right? And I think that bereavement doulas definitely do provide that extra support, as you were saying, Jasmine, like on all of that, and without judgment, because I think oftentimes people who are experiencing loss, which is probably like a whole other conversation aside from bereavement doulas, is the judgment associated with loss. No matter what that loss looks like, there's a judgment that's attached to it. And you know, it's about time we stop having those mindsets of like, well, did they do everything that they were supposed to do? They ate this or they did that. And it's like, can we just not go there? And the value of having a bereavement doula is a non-judgmental support system. And it's about time that everybody have access. I'm a huge person to, or I'm a huge advocate of saying like everybody deserves access to support, period. All birthing people deserve this type of support. And anyway, and that's part of the thing, which I'll give a shout out back to the Baltimore Doula Project, because that's what they are working so hard in doing, is making sure that doulas are accessible no matter what, they have access. So, and we'll make sure at the end that the links to everybody's organizations, especially if they are providing free or low cost services to people who need access to these, so that you can help support and further the mission and in providing these resources. Okay. Now, back to your regularly scheduled program. So now I want to take this back to Carling. So let's talk about what a bereavement doula looks like, or an abortion doula looks like, in providing that support. Because a lot of people, the imagination goes wild and they don't know how that even is like a thing. So can you enlighten the viewers of what that is?
Yeah, absolutely. So an abortion doula is somebody who supports someone during an abortion experience. And there's a few different ways people experience abortion in terms of like how the procedure is done. There are pills that can be taken in multi-steps, and most of the process takes place at home or a chosen place. And the way that our organization and our doulas support people through a medical abortion experience is by being available pre, during, and post-abortion as somebody to talk to, someone to go over their options with, someone that it can be on call for them during the experience if they want to just like have someone to check in with. I think it's important to be aware that doulas are not medical providers. While some doulas are medically trained, our role is specifically as support people and providing resources and information and being someone to be able to talk to. And the place where someone is getting an abortion, they offer medical support through like a nurse phone number and take home resources and things like that. So the doula doesn't do those things, but we can help with guiding people to the right resources if they need to. And then we also do, post-abortion check-ins with people as well. Because of COVID, that's most of the support that we're able to provide right now, because in-person support isn't really an option, unfortunately. But prior to COVID, we have been offering in-person support during surgical abortions at 3 places in the Baltimore area. And we have volunteer doulas that go to these locations numerous days a week and everyone who is having a surgical abortion that day is offered a free doula. And if they want to utilize that doula, they can. And what that looks like is that the doula is then present with them in the procedure room throughout the whole procedure. Oftentimes an abortion only takes, 3 to 5 minutes. And the doula is there to be a hand to hold, someone to talk to, someone to just like be present with, who's totally focusing on their experience, what they need in that moment. Sometimes it's being a helpful distraction. Sometimes it's just standing there and knowing that someone's there with you. That's not the doctor or the nurse, whatever they need in that moment. And often we can check in with people after their procedure as well and provide follow-up resources if they need it. Yeah.
Awesome. Do Rachel or Jasmine have anything else to offer on that type of loss? No? Okay. Carling, I think it's such a valuable resource that I think more people need to know about. And I know that more full spectrum doulas are being trained to be able to support from abortion to miscarriage to stillbirth, and, as well as birthing and postpartum doula support. And I think that this is a really great avenue that, as access is possibly limited in a lot of places, like having access to doulas that know this work and know the community resources is really vital and important when we talk about not only access, but options and choice. And so,
yeah. And I just want to add one thing that people enter into their abortion experience with all kinds of feelings and all kinds of scenarios. And not everyone that's having an abortion is having an abortion because it's an unwanted pregnancy. And oftentimes, abortions are done for pregnancies that are not viable pregnancies, or that we're not going to make it full term, or for other fetal anomaly reasons. And people experience abortion for those ways as well.
A really important piece, because that also goes back to shattering the stigma and breaking the stereotypes of what that care is all about. So thank you for bringing that to light too. And it's important. We need to be talking about this. It's loss, and there's still grief that's associated with abortions and all of that. Anyway, again, we could go on like a whole nother topic of that. So I'll stop. So then let's move into talking about a miscarriage. So miscarriages, are usually up until, they're categorized as miscarriages up until 22 weeks?
16.
Okay. Oh, really? Okay. There's a lot of numbers that are flying around, so my apologies. So we have people who have missed miscarriages. They go in for the ultrasound and have no idea that they've miscarried. And then we have people who can physically experience, they know that they are having a miscarriage. So if someone is having a miscarriage unexpected, what does that look like as far as how do they go about getting a bereavement doula? Is that something that, now again, I'm just throwing these questions out there, is it that somebody automatically just goes on Google and looks up bereavement doula and then that person will help them out? Do they contact a birth doula? Oftentimes these are questions that I get from my clients who know that this is going to be happening, or people who want to support somebody else. So can you guys reference a little bit about what that experience might be like? Jasmine, you look ready to hone in on that one. Okay, I'm going to throw this one to you then.
So a lot of times when I get bereavement clients, they were referred to me from someone else. So they could be a relative of a friend, and they might reach out to me and say, hey, I know somebody who's experienced a loss. Do you mind helping this person? And so, I always say yes, because moms of loss have a special place in my heart. But doula groups, Google, depending on what the organization's SEO includes, in the Google search that can also help with results when it comes up, or word of mouth. Somebody, a friend of a friend might know about the business, and so they might refer the client to J. Mason Foundation. I have received a couple of client requests or questions from my website as well. So there are many ways to find out about a bereavement doula. And I also post on Instagram and Facebook. And I use hashtags as well that will draw attention to my account so that I can get, for one, more followers. But if there is that resource that's needed, they're able to search by that particular hashtag, and then they'll find me that way as well.
So then say if someone gets connected to you, if they're in the middle of a miscarriage, you know, is this, you're still providing the same type of support? Is there something different that miscarriage, a bereavement doula would provide for someone who's having a miscarriage? Like Rachel, you were talking earlier about, like, you know, going to the hospital with a family, and like, what does that look like? Like, how does it work? I mean, is it happening during COVID? Is that still, I know with birthing doulas, there's a lot of restrictions that are going on right now in the hospitals, but what does that look like? People want to know.
And so it just all depends. Like, for me, a lot of the barriers for me accessing the person is the location. Because I'm in Northern Virginia, I might get someone that's in Tidewater, Virginia. And of course, I'm not going to be able to drive 2.5 hours in the middle of their miscarriage to get to them. However, I do provide support over the phone as needed. So if they want to call, or if they want to text or FaceTime, that's totally fine with me. I just try to be needed and helpful in many ways. So I don't limit it to in-person support. I haven't received many bereavement clients that are in this area that I'm in, Woodbridge, but I have received clients that were Hampton, Newport News, Virginia Beach, Norfolk, that area, which I'm only limited to phone support then.
Rachel, what does that look like? Because I know that you've been, just because I know you a little bit more for the work that you're doing, and on the advocacy side of things with getting back into the hospitals, are you getting calls from nurses and OBs? Are you getting the calls directly from families?
Yeah, so you had mentioned before access, right? And having access to doulas. And I think one of the big barriers to people getting the care that they need really is that a lot of providers in hospitals really aren't prepared or equipped to make these connections. Often what we're hearing from families is that they go to the ER because they have some like unexplained bleeding. The ER diagnoses a miscarriage and sends them home. And there's no provision of support. There's no provision of like, here's who you can reach out to. There's, as we've already discussed, there's a lot of stigma, a lot of shame involved in it. This is, I think, you know, particularly so, you know, for certain members of our community more so than others. I mean, we see this much more for women of color, even like a heightened level of shame superimposed on that. And it makes it more difficult, I think, in a lot of these cases to reach out. So a lot of the support that we're doing, as I mentioned, is after the fact, where people, the miscarriage has finished and it's weeks, months, years down the road, and they're looking for that bereavement support, or they're pregnant with a second or a third child, and they're planning for, you know, for the rainbow baby, and still grieving the loss of an earlier pregnancy, and now having to process that. So, you know, it looks like a lot of different things. Honestly, it looks different for every family. It depends very much on their circumstances and what sort of support they had. But a large part of what we try to do is make that connection to say to, you know, hospital staff, to hospital administrators, to administrators and staff at different clinics in the area. If you are, you know, if you encounter a family that's experiencing a loss or anticipates experiencing a loss for one reason or another, please put them in touch with us or, you know, other members of the community that are also doing this work. There's a lot of us out here. We are happy to provide support. It's just often families they don't know to ask about it until like well down the road, and then we're trying to sort of backtrack and, you know, I will say though, I've seen a very, very big shift in this over, I mean, I've been a doula for 10 years and years ago, we could only attend medication abortions because we couldn't go into clinics. Now there are doulas who can go in clinics for abortions. Now we can, we have hospitals that are providing later term abortions for medical reasons, right? When there's, a fetal anomaly or something like that. And we've been able, I mean, Washington Hospital Center has, at least in a couple cases, helped connect us with a client that is going through this process, and we've been able to be in person in a hospital. Obviously, COVID's been a limiter to some of these things, but a lot of I'm here in the DC area, and a lot of the hospitals are starting to reopen to a second support person, which gives us the opportunity to be back, in person, providing support during the family's experience, hopefully before and also after. So we're bridging that whole divide.
Yeah, so we have, I'm so excited that we have Tamira Dunn, who is the founder of Elijah's Hope. She's watching us right now. So hi, Tamira. And her biggest comment that she put right now is that oftentimes you don't hear about the bereavement doulas and until it's like after the fact. And then the other component is that the medical community isn't telling their patients about it. Yeah. And that's one of the other parts of awareness, why we do these events, is that the more we talk about it, the more we're normalizing this type of access to care, and that we have so much more work to do to make sure that people are aware of making the referral to bereavement doulas, and not when it's years down the line. Like we want to be able to provide that current present, if it's desired, because we know that sometimes people aren't ready to invite someone into their sacred space when they're going through this, because it is a very sacred time. And sometimes it's hard to have strangers come into that space when there's no pre-gaming, like with a birth doula. You get to build that relationship, and sometimes you don't get that same type of connection. So thanks, Tamira, for bringing that up, because it is really, really important work.
I think another example of how it's changing is in the past, bereavement and loss support wasn't really part of the trainings for doulas. I remember in my training like 6 years ago, I don't remember that being talked about at all. And, especially if you are hired by a client for birth support really early on in a pregnancy, it's quite possible that they might experience a loss. And as doulas who are supporting people through a birth experience, like we also need to be prepared to support people through loss. And also people who may be planning on having a pregnancy to term might have a history of miscarriage or a history of abortion, and being able to understand what those past experiences are like and how they influence their current pregnancy is really important as a doula.
Absolutely. Absolutely. Because the goal is not to cause further harm. The goal is to minimize the amount of trauma that one might experience, and to provide that comfort of guidance all the way through. Because if we bring in our own ignorances into a scenario, we could eventually be causing more trauma for that person if we're not informed the way that we would hope. Or you have birthing doulas who don't have that type of training, and they're not comfortable with supporting someone with loss, because then that's the other piece to it, is everybody goes into, not everybody, but many people go into birth work thinking that it's all sunshine and rainbows, and without the realization, the reality is that 1 in 4 people are going to experience a loss. And that's a huge statistic, and I hate throwing out stats, but that's kind of a big deal. And so, especially as you were just saying, is that if someone has a history of that, there's going to be anxiety for a lot of people, not everybody, but for a lot of people, there's going to be that anxiety. And we know as birth workers, what happens when we're really tight is that things can be prolonged if we don't release that stress, right? And in theory, it sounds all like easy peasy, but we know that it's not. And there's a lot of work that doulas can provide in that support by being aware. I mean, that's what it really comes down to, right? Is the awareness. Unfortunately, like there are a lot more trainings that are coming about. And I know, Jasmine, you trained with Sisters in Loss for part of one of your trainings, right? And that's been an incredible new training that's been popping up with Erica, which we're having on later in the month, in addition to Tamira from Elijah's Hope, who are trying to change that conversation about empowering more people to be trained, especially people in the Black communities, because that is a very, very important piece, which I feel like you want to hop in on that because you just smiled on that connection. Okay, I'll let you take it.
Definitely. Black birthing people typically try to go for a Black doula. And a lot of times when I'm asked to be a backup doula for someone else, they say this parent or birthing person is a African American. I prefer an African American backup doula to support this parent. And so a lot of times they'll just come out and say it. So I feel like doulas are needed, bereavement doulas are needed, but especially African American doulas, they're needed as well. I feel like a lot of disparities in the birthing room happen to African American women. They just It's something about the way the medical system treats women in general, but especially African American women. So I was very excited to get trained by an African American doula who was already doing birth work, who was already using her voice on her platform to talk about loss and why bereavement doulas especially are needed. Because as Rachel touched on, a lot of times when you go to the hospital, they say, oh, you're having a miscarriage, and they just send you home. Especially for myself, out of personal experience, with my second pregnancy, I had what is called implantation bleeding, which I assumed that it was a miscarriage. I wasn't really sure what it was, but because I had a previous miscarriage, I automatically thought I was losing the baby. And so I went to the emergency room and I said, hey, I'm spotting a little bit. I'm not really sure what's going on. Can you please check me? So they did what they did at the hospital, and the lady told me, oh, you're having a miscarriage. And she kept saying, I'm so sorry. I'm so sorry. Well, turns out I wasn't having a miscarriage then. They said I was having a miscarriage, but I think I was about 6 or 7 weeks around that time. I think so. I hadn't gone to my first OB appointment yet, but they were saying I was losing the baby then. I didn't actually lose my baby until 19 weeks. I was almost at the 20-week mark. So these are the types of things that happen in the hospital to women, especially me, myself being a Black woman, and this nurse is a Caucasian nurse. And I just felt like there was no compassion at all. It was just like oh, I'm so sorry. Here's your discharge paperwork. You can go type thing. Like it was so rude. And I just felt like, wow, is this really happening to me right now?
Yeah, it's just, I think we're all listening to you share your story. We're all boiling inside. It's like the rage starts to like peak, and we've got smoke coming out of our ears and out of every orifice possible. But this is why I think we're starting to see more of the expansion of the trainings coming out, is because we have to be there. It's almost like it's not, it's almost, it is a necessity to have the support, to have someone who's going to be able to advocate for you when you're not sure, and to be like, okay, these are the questions you can ask your provider, or maybe these are the things that you can try for some of the cramping, or just here are the mental health resources. Because as we talked about last week, we had a number of therapists on, and we talked about it from that perspective, scope of practice, and just that like we need to make sure that people are referring to these resources and that they know that they're available. Because that can be traumatizing, going to the ER and then being told one thing and then really something else is happening. And then it's like, whoa, okay, like system overload. And then you're traumatized on top of trauma. And it's just like this never ending cycle. And yeah, oh my gosh, you guys, I'm like totally fangirling over like the work that you do because you're so important. You're so important. We don't talk about this enough. Okay, anyway. But okay, so we just talked about if someone is going to the hospital. Um, what about if would the same thing be applicable to a home birth if there's a miscarriage happening? Do you provide support if people want to miscarry at home? I think that's another question that I've actually been getting recently from a few people. Since Chrissy Teigen came out and shared her story, there's been an abundance of conversation, which I think is great. I think that's when celebrities come in handy sharing their story, because it's like, we should be sharing pictures. We should be talking about this. This isn't something that's swept under the rug. Like, it shouldn't be. Like, how dare us as a society to not talk about death and dying? And it's one of the things that our culture is just not so comfortable with, unlike other parts of the world where they have these conversations, and not that it's embraced with open arms, but at least there's a more of a conversation and dialogue to talk about it, which is why the mental health piece is so important. Anyway, okay, I digress. Back to home birth. If someone knows that they're miscarrying and they want to miscarry at home, in addition to, if they choose to have a midwife at their home, or they just want the extra support because their doctor sent them home, like Jasmine was saying, like to be sent home to miscarry, is a bereavement doula something that can be of support for that too?
Yeah, for sure. I do want to just start by clarifying that we are not midwives, we are not medical, so we're not there to provide medical support in that capacity. So for us, for later term losses, typically past 24 weeks, if that's going to be happening at home, in conversation with the family, typically we would require that another medical provider be present, because there are some risks associated with later term losses when that's happening at home without some medical support. But for earlier term losses, or losses where there's medication abortions, for example, where they're at home, that was actually sort of how we got started as bereavement doulas, was providing support for medication abortions, particularly because families go home and there is such a high risk of hemorrhage in particular, but also the emotional needs, the physical needs, the mental needs of going through this process. And, kind of like with the miscarriage, you go to the hospital, they tell you, oh, well, the pregnancy's over, go home and, good luck. That's often very similar to the stories that we're hearing from the families going through a medication abortion, where they're given a medication and they're sent home and told good luck. And they don't have the support network. And for a lot of the families that we've worked with, a lot of the individuals that we've worked with, they really have no support network. Often they're alone, and they are at home with either medication and then a medication abortion, or with a miscarriage with no support person. And a lot of them, I think, because of the stigma, because of the feelings of shame that either they feel or that are sort of superimposed on them, often they're not reaching out for help from friends and family. And there seems to be this need to hide it as much as possible and keep it kind of, internal. I hear a lot of like, I don't want anybody to know because I have to go back to work tomorrow and I don't want people to know what happened, which right away tells us that we don't have a support network for this. They're trying to go back to work tomorrow, right? Like, we're trying to just, put it all behind us, pick up where we left off and just keep going. And so the role of the doula is really, really significant in that home experience to help make space, honor space for this, give them the chance to grieve and be present in that moment when they may honestly have no other support system for that. And then tomorrow they're going back to work like nothing happened, but their body is still grieving, their mind is still grieving, their heart is still grieving.
Yeah. And I think it's important that people know that they can have that type of support. Recently, well, I think it was last year, but it's resurfaced just in the last couple of weeks. There was a woman who had documented her miscarriage, and she knew that she was going to have a miscarriage. Originally, she had intended on having a home birth, and she decided that she wanted to miscarry at home, and it was beautifully photo documented, the whole journey, and it was very, very heartfelt. And she had her midwife there, and she also had a doula there, who everybody was like originally a part of the initial birth plan, birth team. And it was just so beautiful to see how everybody had a different role in supporting the emotional and the physical desires, I guess to say, and like the coaching that was provided to the birthing partner and to the birthing person. And it was not to say that it was like beautiful, but it was beautiful because you want everybody to feel supported. Now, then there's people who don't want the support. And that's the other piece, and that they don't have the grief associated with it as well, but they want the doula more for the tangible resources, what do I need to do? Who do I need to go to? But the emotional support isn't what they want the access for. And that's the same thing with birth and postpartum doulas too, right? Which I'm sure all of you guys see. So I think it's also important to acknowledge that not everybody has like this this image of, I don't want to say attachment. I'm missing out on my words here, but not everybody feels the sentiment of the loss in the same way. And I think that it's also important to validate that as bereavement support systems, because we want people to be able to process so that their body can do what it needs to do. Because if they do rush back to work too soon, we know that that can cause physical harm if their body isn't recovered. And we know that that can be serious. Sorry, I'm like tripping over my own words here, but we also know that some people just need the simple reminders of like, here's the checklist of things of what you need to take care of for you physically. If you need to make follow-up phone calls, like these are the people that you need to reach out to. So I just wanted to give that highlight too, because that's been another part of the conversation. Is someone said to me last week, like, is there something wrong with me because I'm not grieving the way that my sister or my friend did? And I think that that's also important to bring to light when we talk about the bereavement support, is that not everybody is going to have the same type of reaction to a loss. So I just wanted to put that out there, because I know there's people who are watching who have had some of those experiences. So I just wanted you to know that you were seen and you were heard and validated and all of that. So yeah, so just want to say that. So a comment that we got on here is, so with going back, I just want you guys to know what's being said. So when you were talking about how if somebody goes to the ER, the lack of support, and then being sent to just go home and then call your OB. So somebody had responded with, that's exactly what happened to them 2 weeks ago. And they had the miscarriage, and they were told just to call their OB. And there was no, okay, this is what you need to expect. This is what you need to make sure to do. If these are an issue, yada, 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 yada. It was just like, okay, next. And that's part of the frustration I have as a body worker, is that I have clients that come in and they're holding on to all of this stuff, this anger and this frustration. They were just another person, just another chart number, and not validated as a human experience that they just had this loss. And this is what you guys do. You guys are like amazing people. Oh, just one event. That's all we have this month. I might need to do another. Anyway, sorry, Carlene, you want to say something?
Yeah, I just want to add a couple of things that I also see the role of a doula playing, in that our job is very much to normalize what the experience is, because as we've talked about, there's such a myriad of experiences. Each miscarriage can be different, and your feelings about your miscarriage can vary, and your experience compared to your friend's experience might vary significantly. So we're very much there to be present, to acknowledge that whatever you're feeling or however this is playing out is normal. And if it's not normal, especially from a medical standpoint, then we, provide the resources to get you the care that you need. We acknowledge when is the time to go to the hospital or to call your doctor. And then the other piece is that we aren't always just a doula for the pregnant person. We are also the doula for other people that are present or are privy to this situation. So a partner or other family members or close friends who can be feeling, grieving this experience just as much or even more than the pregnant person. And so we're very much there to provide support for that person and also guidance in how to be a helpful support person. I think if this is a new situation for people, often we don't know how to show up. We don't know what are helpful things to say or helpful things to do. And a doula can be really pivotal in providing that guidance for how to be present for people.
Absolutely. Because everybody involved has a different role in that relationship. And that's really, really important. Yes, yes, yes. You're hitting on all of this topics. All of you guys, this is great. Partners are very, very important when there is an active partner involved, because that's the other thing that often comes up is my partner is not dealing with this the same way that I am. And then the birthing person gets frustrated. A lot of times we'll hear that, like, why are they just moving on? Or, they're not crying as often as I am, or they're sweeping it under the rug like nothing happened. And we know that there's always more to the story, but making sure that everybody has the support that they need to process for sure. So yes, rock on. So then with that being said, if a family or a friend wants to gift this opportunity to somebody, is it as easy as just making a phone call? And then what happens? Then you make a follow-up phone call to the person that they're gifting it to? How does this work from your perspective within your scopes?
Go ahead, you go first.
So usually, if somebody is gifting a bereavement doula to someone, in my case, they would reach out to me first. And then I allow the birthing person who's experiencing the loss to reach out to me when they are ready. A lot of times they're not ready to talk as soon as they experience the loss. And so I don't want to bombard them with so much communication right after it happens, because when you experience a loss, if anyone on here has experienced a loss like I have, right afterwards, it's not a time to ask me questions. It's not a time to say, are you feeling okay? Because of course, right after, I'm not okay. I'm sad, I'm probably crying, I'm emotional. My emotions are probably all over the place. So when that person is ready, which is usually within a day or two, they'll reach out to me via phone call, email, text message, website. But I do allow them that space because I know what it feels like to lose a baby. I know what it feels like to lose two babies. So I know a lot of times afterwards, you just kind of don't want to talk. You need that space to decompress or process what just happened.
Yeah, I agree with that so much. I think also it's really important to, if family and friends are interested in gifting a bereavement doula, I think there's a very important piece, which is that that we need to make sure that we're honoring the space and are they ready to discuss. But also one of the pieces that I think is really important too is the rightness of fit between the doula and the person who's experiencing the loss. In an ideal circumstance, we'd have been able to meet beforehand and make sure that there's rightness of fit. But I think one of the really significant things that we have to keep in mind as bereavement doulas is that we are not necessarily the right bereavement. Just the fact that we have that skill set doesn't mean we're the right doula for this particular person. And honoring and recognizing that is really, really significant, because I've been called a couple times by a colleague or somebody, and like it's clear right off the bat that like I may be a very good doula, I may be a very good bereavement doula, but I might not be the right doula for this context. And whether that's a matter of culturally congruent care, representative care, or just personality fit, like whatever it is, I think we need to be very careful to not impose ourselves. And so if family and friends want to gift this service, I love it. It's super easy. We can, I mean, we can sign up at any point and help a family, help the family process, help friends process. And if the time is right, if the birthing bereaved person is prepared now to have a doula, we will be happy to. But again, that rightness of fit is a very, very key component of that. And making sure that this is, that we are the right doula for this circumstance and for this person as they're experiencing it. So, but I love, separate from bereavement around the birthing time, I also do end of life work at like the other end of life. When, for families, often there's a loved one that's dying after dementia or Alzheimer's, where we're not really so much supporting the dying person in that case, because they're probably not articulating their needs with us in a way that we can communicate with them as openly as with the supporting family and friends. And so really in that role, our job is to support the community around the dying person. And I see that role very strongly in bereavement work surrounding birth as well, where really our role is to support that whole community and make sure that the chosen support network that already exists around this person has the support that they need to be supportive, to be that village that the person is going to need when they're ready. So doula by extension, right?
Yeah. Carling, do you have anything to add?
So for Baltimore Doula Project, people can get in touch with us through our website, baltimoredoulaproject.org, and you can find our email address. People can email us directly. We do have a phone number people can call as well. The getting in touch with us looks the same, whether it's someone gifting a service or the pregnant person directly getting in contact with us. And we have a network of trained abortion doulas and loss and bereavement doulas. So clients are welcome to meet with multiple doulas to try to find the right fit.
You guys have been growing by leaps and bounds over the last couple of years. It's been so beautiful to watch. And then the partnerships with the other area organizations to further the training that you guys provide to grow your volunteers. So I just want to tip my hat off to you guys, because I think it's amazing just watching you grow and flourish. So we actually got a question in, and I think we kind of touched on it, but we didn't expand on it. And Maggie is asking, how long would a bereavement doula relationship typically last? And I think it also depends, probably depending on what the needs are and where they're at with their loss, I'm guessing, but I'll let you guys, the professionals, say.
So when I teach childbirth classes, I say that the doula's answer to everything is it depends, right? Because everything just sort of depends on the context, on the needs. And I think this is very much one of those cases where it depends. I have, as you mentioned, Jessie, there are some people that don't grieve as much for a loss or don't perceive it as a loss, which is fine. And they may not need as much support, or they may not need as much support now. And then a few years down the road, they need more support or care, or to, even just have an open channel for communication, just to discuss, to process, right? So, we have families where we're working with them for a couple days, a couple weeks, a couple months. And I have families that have contacted me years later, sometimes with good news that they're pregnant again, and that, this baby is looking healthier and they're anticipating a term birth. I have families that reach out every year on their baby's birthday. We kind of chat and process together, and, remember the birth and the death of that baby. And all sorts of other variations on that. It really just, it depends on what's needed.
I definitely agree with that answer. And this goes back to not everyone grieves the same way, because some can have a miscarriage or abortion or stillbirth, and then they seem like they're fine. They just need a little bit of push with the resources, or actually scheduling appointments, whether it's therapy or attending group therapy. And then you have some who take it really, really hard. And where you think that you might work with this client for a month, you end up working with them for 2, 3, 4 months, because and it also goes back again to, you're not just supporting the person who lost the baby, you're supporting the family. So it may be you're starting off with the birthing person today, but tomorrow you're working with the partner. The partner may need support, or if there are other children in the family, the children may want to understand what happened. Why is so and so upset? Or, you know, whether it be their mother or their father, they might ask, why is that person upset? What's going on? And then, you know, it leaves it not just to the doula, but sometimes a lot of times it's left to the doula to explain, okay, well, mom just lost a baby, and, you know, what does this mean? And this is why mommy may be sad, or daddy may be sad, or whomever may be upset. So I know a lot of times I end up working with the client longer than expected, or longer than I planned to.
Okay, and oh, Carling, were you going to say something? Sorry.
Yeah, just real quick. So a lot of our support centers around abortion, and our relationships with our clients tends to be pretty short-lived. We're working with people over a few days for an at-home medical abortion, and for a surgical abortion, it's really during the procedure. So we're talking about a few hours. We're always available for people to follow up with us, and we give people our card and they can contact us whenever. But we tend to see that most people do pretty well afterward, after an abortion experience, that they feel pretty okay. Most people have at least somebody that they can reach out to or talk to. But we are definitely available for people for the long term if they need us.
Awesome. Thank you guys so much. So I have one last question, because I know it's going to come up. And Maggie said, thank you, by the way, for answering that. So people often, you know, they go into like a birth or a postpartum doula experience, and they know financially what they're getting themselves into. And this is the dreaded question that everybody always dreads, is, you know, the financial piece of, well, what's this going to cost me? I'm grieving. And, you know, if I had to pay for a funeral, or if I had to pay for this, like, now I have to pay for, like, how does it, which is why, you know, I wanted to talk about the gifting piece, because I think it's important that that's something tangible that, like, a family or a group of friends or a community can get together and they can pull in to help make that support possible, which people should be doing anyway for birthing people. Just saying. Okay, anyway, another high horse conversation. But what does it look like, you know, if someone is going to be doing a bereavement doula, especially if you're talking about, it may be short term, maybe just like, you know, a few hours or a couple of days or a couple of months. What does that look like with regards to the fee for the service?
So typically, I do have a fee on my website for bereavement services. However, I always waive the fee. Not always. In most instances, I do waive the fee. I did have a doula scholarship fund over the summer that I was collecting donations for, to where people can donate towards doula services to those who cannot afford it. So 2 of those bereavement clients did receive the scholarship, and then the rest of the doula services that I provided to those who have experienced loss have been free, just because I know what it's like to experience a loss and to not really be able to afford to pay for a doula, or maybe their cousin text me and asked me could I provide support, and then they sent me a donation. So anything is fine with me when it comes to bereavement, just because I know that the funds may not be there, or the person, they need help and they don't know where to look for a service or a person that will be willing to help them cover the cost.
And I just want to put this out there. Like, I know that this is a service that people are providing, and all of you should be rightfully compensated for your time and your energy, because it does take you away from your family and your friend. And it does take you, for some people, it takes you away from your full-time job if you are doing multiple types of roles. So I do want to say that, where I personally do not expect you to do anything, for free, but that this is an opportunity where this is why we're educating the public, is that so that people can contribute to the organizations that are providing these services to make it more accessible. Again, it goes back to everybody should have access to these resources. I cannot say that enough. So if you're watching this, don't you worry, because there are going to be links popping in the bottom of this conversation on the Facebook stream, and where you can send donations to Cash App, Venmo, PayPal, direct website. Y'all better go and make some contributions. So anyway, okay, back to our regularly scheduled conversation. Carling, I want to hop on to you guys, because I know that for a Baltimore Doula project, you do rely on donations to make a lot of these resources accessible. I mean, I know when the organization originally started out, it was done on a sliding scale, but things have kind of changed as an organization. But how you have evolved with the abundance of people that you're providing services for, in addition to the trainings that you do and all of that stuff. But what does that look like now if someone wanted to access your services?
So for our abortion doula support, all of our services are free. We work completely with volunteers that are happy to donate their time to support people. But people are more than welcome to make a donation to us. We will happily accept any donations and utilize that money very well. There's plenty of things we can put that money towards. And our loss and bereavement support is, it's on a sliding scale. We don't want finances to be a barrier for anybody, especially going through a really challenging experience that wasn't expected. And especially if someone's considering a bereavement doula and they feel like maybe I'll pass because it costs a certain amount, we'll just be there for you. Just get in touch with us. We'll show up.
Y'all are giving me goosebumps. I love you guys. Okay, anyway, Rachel.
Yeah, the same is true for us. We offer sliding scale services. We want to make sure these services are accessible to the people who need them. And so inability to pay a certain fee should never be the barrier to getting the support that you need. But we do want also to honor this experience for families, and we do have families that want to pay and want to pay a certain amount, because that's for them part of honoring this and honoring the birth process for many of them. We also sometimes we're working with a family and they've already paid our fee as birth doulas, and then they experience a loss. And so in certain cases, we will gift back part of their fee, or they've asked that we apply it to, that we donate the fee as a gift for something, or we apply it to another family. So, we do have a small scholarship fund that we can apply as well for families. So, sliding scale services, donations, gifts, we're happy to make this service accessible to the families that need it.
So the bottom line, if you're watching this, finances should not be a hindrance to your accessibility of getting yourself a bereavement doula or someone you know. Wow. Okay. So we have now reached our time of an hour of our lovely chat this evening. Is there anything else that any of you who are one of the panelists, or if you are watching live, any last minute thoughts or questions or points that you want to drive home on this topic? Speak now, forever hold your peace, or just tell me later.
I mean, I just want to say, oh, sorry, go ahead.
No, you can go.
Loss is really normal, and you probably know somebody that's experienced a loss. And I think there's a lot of really great resources out there where anyone can be a doula for somebody. So if you know someone experiencing a loss, feel free to reach out to us just for like guidance or tips. And there's great resources online as well.
So I have a watch party going on my Facebook page, and someone commented that, you know, the mother always, she feels like she's carrying the guilt of loss alone. And just a thank you for talking about the feelings of the partner, because a lot of times we don't acknowledge the partner's feelings after loss. So, you know, to ensure that the partner has support as well, to me is always a good thing, just because the partner grieves too, and the partner may not show their grief, just like the birthing person does, but it doesn't mean that they're not grieving.
It's true. Very true. Thank you for sharing that. Rachel, any last parting words?
I'm just so grateful that we've all been able to gather and discuss this and normalize it. I know, like, I've had 2 losses. I know I'm not alone here. And I imagine that for many of the people watching tonight, and thank you for being here, that this, you know, this might be your story too. And so I'm glad that we're able to open this conversation and share and help to normalize it and help to alleviate some of the shame and the guilt that sometimes goes along with it and that stigma. So very glad that you hosted this conversation. Very glad to be a part of it.
Well, I'm definitely grateful for having all 3 of you on as panelists. You all offer very unique, beautiful perspectives on the work that you do, and it's important that people know. And that's why we're having a month-long series of a lot of events that are going on. Thursday coming up, whether you do it with myself or with other community organizations, locally or internationally. October 15th is the Global Wave of Light, where 7 p.m. your time zone, we light candles in remembrance of all the little ones gone too soon. And it's a way of remembering your babies, whether or just honoring your pregnancies. So we invite you to be part of that. And next week, coming up on Tuesday, the 20th, we have an incredible writing workshop with Eladrian C. Wetzel. She is a local actress. She's a local director, producer, playwright, you name it. She's one of the co-founders of Two Strikes Collective, a theater collective based in Baltimore. And she herself has experienced loss, and she'll be guiding participants through a Writing Through Grief workshop. And that is a Zoom event, not publicized on Facebook for privacy and intimacy purposes. And there's still time to sign up for that. There's a month-long series of events. So if you haven't seen the list, go back to the event tab on this page, and you'll be able to see all the events. Thank you all so much for participating as panelists and for guests and sharing your stories and asking great questions. We are so, so grateful. And here's to continuing to shatter the stigma and to talk about it and to do about it. Thanks so much, everybody and panelists. Hang on for 1 second, and I'll be right with you.